go. Setting up live. All right. Thank you, everyone. It looks like we have some attendees who are continuing to log on. I really appreciate it. All right. Our live stream's up. Our Zoom is up. Our speaker's here. We're good to go. Good afternoon, everybody. My name is Brittany Quick-Warner. I am the President and CEO at the Eugene Area Chamber of Commerce. We are really excited today to talk a little bit about the impacts of COVID-19, specifically on the medical world, and kind of get an inside look at some of the response efforts from our local hospitals, and hear a little bit more from a doctor's perspective, where our community is headed, how we've been able to manage this crisis so far, and to learn any tips and tricks or forecasting that you guys have been doing. I am joined by Dr. Jim McGovern. Jim is the Vice President of Medical Affairs for PeaceHealth Oregon. And he's currently serving as the incident commander for the incident command structure at PeaceHealth. Dr. McGovern, you came from Wisconsin, is that right? Or Wisconsin-based Theta Care, if I'm saying that right?
Yep, that's correct.
Where you served in several leadership roles, including the Assistant Vice President of Medical Affairs. We're really excited to have you here in Eugene and to have your expertise specifically right now in this time of crisis. So I have a handful of questions that we kind of talked about, but I thought I would just kick it off by letting you talk a little bit about, where PeaceHealth is right now and what you guys have been doing and what role specifically you've been playing.
Sure. So I think we're in a good spot. I usually go out of my way to thank the community. Really, from a health system perspective, we react to the situation that the community creates. So if you look at New York or New Orleans that had Mardi Gras and their health systems being overwhelmed, we fortunately didn't have any of those events. So we really are in a good place right now. We have plenty of beds to be able to take care of COVID patients. We don't have any in-house at the moment. So the first month or so of this, we spent a lot of time working through our patient flows. How do we sort of separate, if you will, those patients with respiratory symptoms, possible COVID, into different waiting rooms? How do we set up isolation wards to take care of people there? And we've continued to do that now with some testing that's become available. So we really have worked hard to make sure that we have a safe environment for people that don't have COVID, and take really good care of those that do, as well as keep our staff protected, do everything we can do to support staff through all of this. So I think in Wayne County, we've been fortunate. I don't want to say only, we have 2 deaths, which when you compare ourselves to other places across the country, really puts us in a fortunate spot.
Yeah. So when we were at the peak, if you will, if it does feel like it peaked, what was it like then? I mean, I assume you had patients at some point that were using our local hospital.
Yeah, I think at peak, we had 4 positive patients in-house. So really very well prepared.
Yeah.
I think with having our elective surgeries, making that decision to close those down and having the governor with the order, we had plenty of beds in-house. I think at one point in time, we had 60 or 70 beds open, and really well prepared to be able to manage any type of real surge. Mm-hmm. So I would say in Wayne County, the health systems in general were not at a place where we felt threatened of being overwhelmed.
So, I mean, you've talked a little bit about it, and all of us, if you're like me, are spending way too much time watching the news and kind of obsessing over all of it. It seems like we're faring pretty well compared to the rest of the country.
I think we are doing well. I think that is in large part due to people staying home, self-isolation, being careful when they are out in public. So I think from a Eugene, Springfield, Wayne County perspective, we've done a very good job of limiting the spread of COVID and not letting it get out of hand.
Yeah. So I think the thing that everybody is just super, at least feels a little bit in the dark about, is testing. So let's talk a little bit about that. What are,
Sure.
What are you guys doing? What is the current status of testing in Lane County? Are we where we need to be, or how do we get there?
We're not where we need to be. And testing can become confusing. There are a lot of brand names out there.
Yeah.
And they run in different timeframes. They have different, I would say a little bit of accuracy to the test in different situations, if you will. For my own personal self, I have to keep it simple. So I really break it down into two types. So there's a point of care test, meaning you can do it in an emergency department or a clinic.
Okay.
And then there's something called PCR, polymerase chain reaction. It's how they look for the RNA of the virus.
Mm-hmm.
So the PCRs tend to be a lot more accurate and reliable. I shouldn't say a lot, but they are more accurate and reliable. The fast turnaround time or point of care tests is better at ruling people out saying you don't have it than necessarily saying you do. So PeaceHealth has a number of different point of care or rapid kit tests that they have placed in Lane County. So all 4 hospitals, and I think a couple of the clinics have it.
Okay.
It allows us to, within 15 to 20 minutes, know if somebody doesn't have COVID. So we can rule it out pretty quickly. The PCR tests typically take a little bit longer. We do have a couple of machines that can do them in 45 minutes to an hour. I believe McKenzie-Willamette also has a PCR machine that might be a little bit longer run time. And I'm speaking for them a little bit, but I believe they can run about 100 tests every 4 hours. Okay. They have the capacity to, same thing as we do. We have the capacity to, but the rate limiting step right now is really the reagents and the kits. Okay. So we could run a lot more tests than we can or we're able to, because every test needs a cartridge, and those cartridges are really in tight supply.
So how are you getting access to those cartridges now? And is it through the state? Are they still giving those out to local hospitals, or how's that working?
So the rapid test that we have is through Abbott. And so our system leadership basically was able to obtain a contract with Abbott that guaranteed us as much as possible a certain amount of tests per week per the system. And so we get an allotment for the system. So this is really PeaceHealth working with Abbott and creating that specific supply chain contract. So Abbott also, I believe, manufactures the kits in the country. And so they're not coming in through customs. And so that allows us to have a little bit better supply chain. Okay.
I want to make sure I'm capturing questions that are over on the Facebook too, in case they're coming in. So, we hear a lot about how, the governor, as she sort of socializes her draft plan for reopening the state, we're hearing that it relies heavily on obviously our medical capacities, right? And that, they're kind of looking at a couple different ways to go about it. One is just sort of, sector by sector opening up, kind of doing it in a phased approach based on the type of business or the type of service that you're providing. But another part of the conversation is a county-based approach or regional approach to reopening. And a piece of, I guess, the gating requirements that she's putting out there is adequate testing, a decline in the number of deaths, a decline in the number of cases that are identified. Where do you think Lane County is on those pieces?
So I think from a declining number of cases, we're doing very well.
Okay.
Actually the COVID cases are on my weather app. So we really are at a new case about every 3 to 4 days.
Okay.
So that's a pretty good sort of low level of activity. So I think from a decline in activity, we're doing well. I think from a bed capacity, for me anyways, I'll speak about my personal opinion. It is more about our ability to quickly open up beds if cases start to go up than it is necessarily having beds in reserve. We're not going to go from 1 case in the hospital to 40 cases in the hospital overnight.
Yeah.
So I think it's important for whatever we do to have solid plans for hospitals to go from kind of 0 to 60 within a week or less. Okay. And I think we have that capability and we have those plans.
Yeah. So, kind of circling back around to the testing component, what's tested positive and then what folks are really kind of thinking and feeling that the community has actually contracted COVID, there seems to be a differentiation there, that folks think that it's far more prevalent in the community than the testing has indicated. Is that, that's kind of a anecdotal piece of information, but do you think that that's true? I mean, if we had higher capacity for testing, would we see far more cases?
So I always try and be careful, my personal opinion.
Yeah.
I'll identify that when I say it. So there's a lot of science out there that is not complete. I think that's a good way to say it. So taking observational studies out of China, Italy, other places, they suggest that 20% of people who get COVID end up in the hospital or sick enough to need to be hospitalized. If that's the case, it is not all that widespread here. Even if you cut that in half and say 10% of the people who get COVID need to be hospitalized, your overall population of COVID here is still pretty low. We run a number of tests. We probably run anywhere from 15 to 30 tests a day in the hospital. And it has been a number of days since we've had a positive. So my personal assumption is that it was really prevalent. Here, we would be seeing more people in the hospital, and we would be picking up more positives. Now, 30 a day in a population of 400,000 is still a pretty small number.
Yeah.
There could definitely be people with mild cases. We've got some hot spots north of us. We've got some hot spots south of us as people travel.
Yeah.
My personal sense is I think that we have been able to keep it from really sort of catching fire in Oregon, if you will, or at least Wayne County.
Do you think that we'll ever get to a point, and if so, how do we get there, that that anybody can get a test if they want one?
I think it's going to be a little bit of time. Again, lots of personal opinions from me. The reagents in these kits that the testing use, everybody in the world right now wants that. Yeah. And so they're in limited supply. You've got much larger places than Wayne County who are in much more of an outbreak and who are preferentially getting tests that's probably appropriate. Okay. So I think we'll slowly build capacity over time. Yeah. And I think one of the things that we'll work with Wayne County Public Health on is keeping a careful eye on people coming into the emergency department, and definitely people being hospitalized with COVID. As we start to see those numbers go up, we're gonna have to react to those, I think.
Yeah. So yeah, how are you guys thinking about the reopening and increase in cases? Do we if you had a magic wand and you got to decide how the state was reopened, how would you go about it?
Well, with or without testing, I think ideally we would do it with a lot of testing, relying on our county public health offices to really do more of a surveillance in the community. I think the state is going to start to do some low-level surveillance in communities as well. I think that would be the ideal if we could really know where it was. Yeah. Outside of that, I think we go slow. We have to find in the short term, I think, a steady state or an equilibrium of people being able to go back out, socialize, businesses opening, while we still kind of keep COVID spread at a manageable and minimal level. So I think that balancing act, we're gonna, I hate to say it, but experiment with it a little bit. We may open up and close back down to some degree, and it may kind of accordion over time.
Yeah. So, if we are able to start to open the state up in the next few weeks, and then, I assume some sort of phased in approach over the next couple months, what for you would trigger a desire to start kind of closing back down or going back to more, stay-at-home orders?
For me, I think if we started seeing more patients coming into our hospitals and emergency department with testing positive for COVID, yeah. I think we are, the hospital is probably the tip of the iceberg, which is what you were referring to a little bit earlier. So if we start to see that tip of the iceberg get bigger, then I think we need to make an assumption that COVID is now again more prevalent in the county, and we need to go back to social distancing and really adhere to those techniques that we've shown to work.
How are you guys planning for if this does kind of ramp back up in the fall?
The fortunate thing about this is we've spent a lot of time in the last 6 weeks planning. So we have designs for what I would call COVID or cohorting units of various sizes. We know where we're going to move walls to. We know kind of when we're going to take an entire unit offline and make that a COVID unit, if you will. So we've worked through the personal protective equipment policies and procedures, the preservation. So we've laid a good framework or groundwork, if you will, to really be able to take that back, ramp it up, and be ready for a larger surge should it happen.
Yeah. So what about antibody testing? We've heard a lot about that happening in other parts of the community. I myself, I feel convinced that I had coronavirus a couple months ago. I would love to know, like, how can I help if I have had it? Or is there antibody testing that you anticipate happening here locally?
I'm not sure. That one still for me is a little bit of a question mark.
Yeah.
I'm not sure clinically how that's going to come into play. There's some suggestion that serum or transfusions from people who have had COVID with the antibody can help people who are acutely ill. I think more study will happen on that over the next several months. The antibody for me is important epidemiology.
Yeah.
From a perspective of how widespread was it? I'm not quite sure in an acute medical situation. I think that one's still a little ways off.
Yeah, that makes sense. Someone asked in questions in advance, is COVID-19 mutating? Will this virus be an ongoing threat?
So everything mutates as just a general basic. So it is. The question I think is really, is it mutating in a way that's clinically relevant or important? I think when you have this many people infected, viruses mutate on an individual basis. It would have to be a fairly significant and clinically relevant mutation for an individual virus to kind of propagate, spread, and then spread through the community. It's happened because of mutation in the wild, if you will. So until we get a vaccine, I think this one's going to be with us.
Yeah. So talking a little bit more about the operations of PeaceHealth and how, this has obviously had a pretty big impact on our community, both public health wise and then also economically. How or what changes has PeaceHealth had to make to support employees or to kind of alter your operations?
So we've done a number of things. So we paid everybody through May 1st. So we did a salary guarantee at least through the early phases. We have secured some housing for caregivers who maybe had an immunocompromised loved one at home or, for whatever reason didn't feel safe going home after coming to work.
Yeah.
We have set up provisions for counseling, financial and emotional, for caregivers who, are struggling with this either financially or emotionally, the stress, if you will, of coming to work. So we've done a number of things from financial assistance to other, emotional, to do the best we can for our caregivers through this.
Yeah. How has eliminating elective surgeries impacted PeaceHealth financially?
Your surgeries tend to be your financial base for any given hospital. Yeah. And so nobody wants to see them go away. Thankfully, PeaceHealth has been fiscally responsible for decades, and that's helped us weather this. So we're not in financial trouble, if you will. We will be fine. But, large part that's due to, the savings and the fiscally responsible business management over the years.
Yeah. How do you guys plan to ramp back up now that elective procedures are allowed to kind of happen again on May 1st?
Well, that's the work of this week. So how do we make sure that we're selecting the right patients first? So those who have been delayed or having more significant difficulties due to the delay, How do we balance things so that we make sure that we have enough beds in the hospital for the surgeries that are coming through and need a place or bed after surgery? Watching our PPE closely, that's always a concern. So really that balancing act, we have not been concerned about blood supply because we just haven't been doing many surgeries and there's fewer people in the hospital.
Yeah.
So now as we start to do more elective surgeries, we'll need to keep a closer eye on our blood supply as well. So all those factors we're kind of putting together this week.
Yeah. So I'm curious if you guys have seen, again, I've kind of read in other hospitals anecdotally across the country that there was also a decrease in other emergencies coming through the emergency department. Have you guys seen that? And if so, how do you explain that?
Looking at our data, we have seen some of that.
Yeah.
I have not. The other thing that I've read and other people probably have too is that the mortality or the death rates have actually gone up,
Yeah.
not COVID related. And I have not seen those for Wayne County. So I don't know that we're experiencing that. I don't have a good answer other than people may be afraid to come to the emergency department or the hospital with their chest pain or some of their stroke symptoms.
Yeah.
And I do want to emphasize we are doing everything we can to make this a safe space.
Yeah.
Heart disease still kills, so do strokes. And so having those warning signs, we still want people to feel safe and come into the hospital.
Yeah, absolutely. And it sounds like, you guys have a low, if not almost no presence of the virus right now coming in as positive cases. So I anticipate that, that if folks do have fears, they should feel better about that.
Right. I mean, and even should we have a surge, we're doing testing on everybody who comes in and needs to stay in the hospital. So we're making sure that our caregivers are safe and the public is safe as well.
Good. So I'd like to talk a little bit about PPE, personal protective equipment. Do you guys have adequate supply? Did you ever experience any kind of shortage in that? And, that again is kind of one of the gating requirements, if you will, from the governor's plan is that we have adequate PPE for the community. And I'm just curious what that looks like from, our medical offices, but then the broader community. Should folks be, wearing those out to the restaurant or wherever once we do it reopen?
So I've continued to say we've been okay.
Yeah.
There are varying degrees of comfort depending on which specific piece of PPE you're talking about. N95s come in different sizes and shapes, and typically an individual gets one size and shape that they're fitted to.
Yeah.
So we can go through, so some N95s were fine. Others we watch very, very closely. We may be down to 2 or 3 days worth and then get a shipment in. So we've been able to maintain enough of what we've needed. But some of that is the community doing 3D printing for full face shields. So we've gone there. We've had some, our supply chain has gone out and gotten alternate vendors. I think somebody locally was making hand sanitizer. The cloth masks that people have sewn using surgical fabric to make surgical masks. So, and we have not used them as of yet, but we have the ability to reprocess the N95s. I think that was in the news over the weekend.
Yeah.
Locally in Eugene, they're going to have the machine to be able to do that. So all of those things put together with being really careful around how we preserve and reuse where it's safe and appropriate has allowed us to get through this.
Yeah, I'm curious, we're kind of exploring the idea of, what if businesses are required to provide or to have PPE for their employees or folks when they're going out? Do you anticipate with the increase in just kind of normal everyday businesses using this as opposed to just medical facilities? Are you guys worried about kind of being able to get enough equipment for you all?
I won't say I have not been part of those specific conversations. I mean, we're really focused on securing the things that we need, for the upcoming weeks, making sure that we've got adequate supply. I think anytime you put strain on a supply chain, things kind of tighten down, and I'm not sure, cloth masks versus surgical grade versus someplace in between, what's needed for the public to be safe. versus what's needed in the hospital, those products may be a little different.
Yeah. How is PeaceHealth working with our local health authorities and the state in sort of weighing in on what you think should or shouldn't be allowed once we do reopen?
So we have regular conversations with Wayne County Public Health. So as far as watching what's going on in the community and making sure that we're on the same page and working together.
Yeah.
We also have, there are weekly calls at a county level and at a state level. So Mary Kingston, our chief executive, she's on a state call for CEOs on a regular basis. Bob Pells is our infection prevention physician. He's on the governor's medical advisory group. So we are in fairly regular contact with them as far as, what are they planning and what are our thoughts. And
so as the Chamber of Commerce and others who have expressed a lot of interest in this question, it still hasn't been made super clear once we are kind of reopening the economy, what the size of gatherings that we might be able to expect through the rest of the year. Do you have any insight on, do we think that we can have festivals and big kind of expos and things like that? Or do we anticipate for the rest of the year that we would need to be at kind of small gathering capacity?
I have not been in those conversations, so I really can't speak to what the official thoughts are.
Yeah.
Yeah,
fair enough. Just thought I'd try. What else? What have I not asked that you think is kind of relevant for the community to hear sort of at large?
I think I'll say again, it's important to say thank you. I think the safety of the community really is a credit to the community and what people have done and how they've reacted to this.
Yeah.
Thank you to our caregivers who come to work every day. There is a lot of uncertainty and unknown around this virus, and the unknown leads to anxiety. And so for our caregivers and healthcare workers really across the state and the county to show up for work every day is huge.
Yeah.
So we are, I guess, on a positive note, we're in a good spot. We continue to work on increasing testing. We continue to, we want to partner on getting businesses open. So from a PeaceHealth perspective, what expertise or knowledge can we provide that we have to help places open and for the community to be safe? And we all want to be able to, go back out again, socialize with friends and do it in a safe, responsible way.
Yeah, absolutely. We have a handful of folks here. Feel free to leave your questions in the chat here, and I can go ahead and get those questions asked. So someone says, let's see, many restaurants are providing food for medical workers. Are there other industries that can give as well that we might not realize it? How have you guys, what are some of the fun or good, feel good stories that you've kind of experienced through this?
Well, I should say thank you. That's a good point and question to all the restaurants and all the individuals who have sent meals into our healthcare workers, including Incident Command. We've had a couple of meals ourselves, so we appreciate that. We've had donations from the community as far as masks. People have volunteered services. I think not only helping us in the healthcare industry, but there's a lot of people out of work. I think food pantries. There's a lot of places where we as responsible and helpful community members can give and help those people who are suffering from the economic losses.
Yeah. So we've talked a little bit about elective surgeries obviously being put on hold and potentially folks being either anxious or fearful of coming into the emergency department if they do have some sort of medical issue. Have you seen or heard any other unintended consequences of, the state that we've all had to be in that, is relevant in the medical world?
I think it's been an interesting transition from in-person visits. I think telemedicine and telehealth, I hear the numbers every day and they don't register with me, but hundreds, if not thousands of televisits.
Yeah.
So I think that's been an interesting development. And then the question for me becomes, what do we look like after all of this?
Yeah.
Does it continue to, does it go back to being in person for some things? Very much so. What can we do over the phone or via video? That one's been interesting for me to watch.
Yeah, I think that's a really good point. We've sort of seen a lot of, maybe some technological resources that people were slow to adopt or even hesitant to do so, that they've kind of been forced into during this time. And, we've heard maybe it's not so bad after all. I think that's interesting to think about in the medical field. What are some of those things? Obviously, telehealth is a big one. I actually had a telehealth doctor's appointment last week, and it was great. I could just sit in my living room and talk to my doctor, and 15 minutes. It was incredibly efficient. I know that's not a solution for everybody, but any other kind of technological sort of adaptations you guys have made that you anticipate might continue to go on in this time?
Yeah, I think continuing along the theme, people working from home versus, the office space and the real estate in the hospital, trying to get providers to sort of link in virtually.
Yeah.
How do we support, Peace Harbor out in Florence, hour and a half or so drive. The subspecialist may not be able to get out there, but how do we get them there when the patient needs them?
Yeah.
That, I think, I'm on the theme, obviously, but that one has been the biggest one for me.
Yeah, that's really good. Good. Well, I really appreciate your time. It doesn't look like I have a ton of other questions here right now. I guess one that I just thought of, how have you guys been working with other emergency responders, right? Our police and fire and kind of their exposure or potential exposure. Have you seen an increase in support needed for those folks?
I think an increase in working with them in collaboration. So back to the last question of what's changed, I think we're much more tightly linked with EMS, with our law enforcement, with our prisons, around what does PPE look like? How do we manage illness? Maybe not just COVID, but other things better together. Our communication from our EMS crews coming into the hospital, bringing patients. What sort of symptoms, what do we need to do to be prepared? So there's been a lot tighter connection.
Yeah, that's good. Someone asked about reimbursements for telemedicine. Is that significantly different than in-person or face-to-face interactions?
Historically, you have not been reimbursed as well if you couldn't really, sort of lay healing hands on the patient. I know that some of the recent congressional stuff has changed that. Those are details I haven't gotten into the weeds on as much lately. I'm sure our finance people have.
Yeah, they're thinking about it for sure. Another question came in. Are there opportunities for people to volunteer at the hospital? I know we haven't had such a surge that maybe it's requiring something like that, or is it restricted really to certified personnel?
We restricted that early.
Yeah.
The volunteers, they almost are essential, actually. They do so much to keep us going. But we felt for their safety and not really absolutely needing to be here for one-on-one patient care. So I'm sure when we open it back up, we'll have opportunities.
Yeah, totally. Good. Well, I think that's all my questions that I had here that have been submitted. So I just really appreciate your time, and I hope that we can kind of continue the conversation from the chamber's perspective. We're really looking right now at how do we move into recovery mode, right? We have the initial response. It feels like the community reacted really well. To your point, folks stayed at home and we've been able to kind of get at least a little better handle on this disease. How do we now go into recovery mode? And for us, that's obviously economic and supporting businesses, supporting the hospital. The hospital's our largest local employer. And we want to make sure that you all are supported as well. So we are looking at convening a handful of industry leaders just to really start those in-depth conversations around what does recovery look like? What are some of the impacts your industry have had? And what can we do as a community to try and get us back to some semblance of normal? So I'd love to stay in contact with you and obviously the other folks at PeaceHealth and make sure you guys are included in that conversation.
Yeah, obviously, we all live in the community, so we're very interested in that conversation for personal and professional reasons. So
exactly, yeah.
Thank you for taking the time to talk to me, and I appreciate it.
All right, that sounds good. Well, thanks everybody for joining in. We will have another one of these Committed to Community webinars on Wednesday and again on Friday. So please check out the Chamber's website and you can register for those webinars, and we will see you all later. Have a great afternoon.
Bye.
Bye.